Good day to all. I am your Dr. J. Prasanna Kumar, Associate Professor in the Department of Physiology in the MAHSA University, Malaysia. This is my second lecture in the series of physiological aspects. My first lecture was physiological aspects of yoga. Now I am going to talk about the physiological aspects of acupuncture. Let us say, what is acupuncture? Acupuncture is nothing but insertion of very thin needles through the skin at strategic points on the body, a key component of traditional Chinese medicine. And here, acupuncture is most commonly used to treat the following things. Most important thing is the pain. What is pain? A pain is an unpleasant sensation, a nociception, which is not liked by anybody. So acupuncture is going to be used to treat the pain in first instance. Secondly, it is also used nowadays after so many research for overall wellness and including stress management. Now, before starting about the uh, acupuncture, we will go into the historical aspects of acupuncture. All of us know that acupuncture means Chinese. Yes, fine. That is true. I'm not telling anything. That is 100% true. Acupuncture it belongs to Chinese only. But its roots are there in India. In ancient India, acupuncture is called Marma Bhedana, otherwise called Shuchi Bhedana. Marma means vital point, Bhedana means to pierce. It is practiced by Maharishi Agastya, the great monk of India. Here you can see the sage, the great monk of India. He was a revered Vedic sage of India. In the Indian tradition, he is a noted recluse and an influential scholar in diverse languages and natural medicinal scientist. He was a natural medicinal scientist. That's what we call Siddha medicine in India. You may be surprised to see this diagram. What is this happening here? Yes, Arjuna, the ace archer in the Mahabharata, is the first acupuncturist. Who is Arjuna? Arjuna was really a very good archer. And in the war between the cousins, he was able to kill his own grandfather because he was representing the other side. And he also shot arrows at strategic points so that his grandfather will not feel any pain at all. Now it is said that he has shot the arrows to front shoe and back shoe points to Acharya, otherwise Pitamaha Bhishma, the great grandfather of this yes archer Arjuna, so that he can live without pain and agony till Uttarayana Punyakala, which is an auspicious time where he can leave his body. So we just consider Arjuna as the ace archer who is the first acupuncturist in the history of India. The second instance is this is a diagrammatic representation of how the arrows were shot at strategic points and the Bhishma Pitamaha was laying on the Sharashayye. Shara means arrows, Shayye means it is the cot. Here another example. Archer Ekalavya, a small boy, he was practicing the art of throwing the arrows from the bow. And one dog was making a lot of noise. He was not able to tolerate that noise and he didn't want to hurt that dog also because the dog belongs to him. He just shot the arrows at strategic points in its mouth so that it should not bark, but it should not have any pain at all. This is another example of how Indians they were also experts in acupuncture. Now, another practice which is practiced widely in the ancient days and also nowadays also in India, that is what is called Karma Veda Samskara. In the Karma Veda Samskara, what they do is the children are pierced in the ears with golden needles. What is the importance of this? This is almost like the auriculotherapy, which is widely practiced in Chinese acupuncture medicine. This is one type of auriculotherapy which increases the intelligence and also the memory of the child. See here, Chinese acupuncture, it is almost similar. Both are same. This is auriculotherapy. One more important thing, one concept is Ardhanarishvara. Ardha means half. Narishvara means female. A female and a male body, half and half. This is an Indian concept of half male and half female. Why I am talking about this, Ardhanarishvara? What is the importance of this? It's not necessary. No, this is necessary because Ardhanarishvara is another version of Yin and Yang, which are widely used in the Chinese acupuncture to excite the chi, that is the energy. Here, how this acupuncture was taught and it was taken to China. Maharishi Jivaka Kumbhariya, who taught acupuncture to Buddhist monk after treating Lord Buddha. This Buddhist monk, he took this knowledge of acupuncture to China. Later on, it became popular in East Asia by name of Chinese medicine. In the next slide, you will see the differences. What are the comparative differences between Ardhanarishvara, half man and half woman, and whereas Yin and Yang, whereas half female and half male, which is depicted in the right diagram. See here in characters small, feminine, cold, subtle texture, rough, quiet, old, dirty, slow, calm, curvy. These are the characters, what they say as the female characters in Yin and Yang in Chinese medicine. Similarly, if you take the Yang, large, masculine, hot, bold, plain, smooth, loud, new, clean, fast, active, straight. These are the characters of the Yang. Yin energy and Yang energy. One is a female energy and another is male energy. They are sitting in the lap of each one of each others. Same thing is in the case of our Ardhanarishwar. On one side it is male. What are the characters that has explained with the Yang? It applies here also. And similarly, the next half is Yin, which where the Yin characters are exactly it is same, which is in this Ardhanarishvara female form also. Now we'll see how this acupuncture it has evolved in China. The first known text that clearly talks about something like acupuncture as it is practiced today is Huangodai Nizing, the Yellow Emperor's Inner Canon. That's a book. Many scholars suggest that it is about 200 to 100 BC in the Han Dynasty era. In traditional Chinese medicine, there are as many as 2000 acupuncture points in the body, but only they are going to use 354 for all practical purposes. And these 354 points, they are connected by four main meridians. A meridian is nothing but where a chi energy, it moves from the surface of the body and its internal organs. Acupuncture is believed to keep the balance between yin and yang. This yin is associated with parasympathetic nervous system and yang is associated with sympathetic nervous system. This allows a normal flow of chi between yin and yang and which keeps the mind and the body in a perfect position. So you can see the 14 meridians here. The first one is the governing vessels, you can see here in this diagram. Then is conception vessels, small intestine meridian, this one, stomach meridian, spleen meridian here, it is coming here, and this side also, lung meridian, you can see this lung meridian here and here also, and heart meridian, which is red in color on both the sides and also on the legs and other parts. Bladder meridian on the posterior side, you can see here. And in addition to that, you can see the kidney meridian it is blue in color, which is on the both sides, bilateral. We call it as bilateral, means on the both sides. And in addition to that, you can also see the liver meridian here. And you can also see the large intestine meridians and pericardium meridian and triple warmer meridian here at this edge, and also gallbladder meridian. What is the importance of these meridians? As I have already told you, these 2000 acupuncture points are situated on these meridians only. It is also true that about 354 points are only used by acupuncturists. What is Q energy? Now we can see here, these are the energy movement. Probably you must have even heard that Russians were able to photograph the aura. There are 7 auras around the body through this Kirlian photography. That is, movement of the energy on the surface of the body, which we cannot see normally. Similarly here, this chi energy is translated as a vital life force. What is vital life force? That is a force which is responsible for, which makes up and binds together all the things in the universe. It is paradoxically both everything and nothing. This philosophy is a bit difficult to understand, but if you go into the deeper philosophical aspects of these things, you'll finally find there is nothing. See, these are again the meridian points with the meridians and also the acupuncture points which are present on the meridians. This is another diagrammatic representation of the points and the meridians, and this is the hand meridians where acupuncture points are situated. You can see here, this is the meridian, and these are the acupuncture points. So now coming to the acupuncture needles, probably it may be interesting to know that in the olden days, the stone needles were used. The stone needles were used for the purpose of acupuncture. But fortunately, nowadays, these acupuncture needles are made up of metals. Even some of the recently we can just see these needles which are made up of the stainless steel. These needles are very very thin, almost something like a hair, and when they are entering, you will not feel anything at all. You don't feel anything at all. And once if they enter into a particular point, they start moving to and fro. They just give a to and fro, which is just sufficient to create a micro injury at that point. I will explain what is the importance of this micro injury later. But in all probabilities, these needles they are going to create micro injuries. You can see the various points where this acupuncture needles are inserted. Here in this case, it is mostly because for the excruciating pain, that is migraine. This is a case of migraine where lot of acupuncture needles are inserted on the face so that the migraine is controlled. This is another way of just introducing the acupuncture needles. This is for the cervical spondylosis and cervical spondylitis also. In addition to that, there are various types of uh, stimulations on the acupuncture points. For example, one is moxibustion. I will explain what is a moxibustion. Second one, acupressure. Third one is laser acupuncture, transcutaneous nerve stimulation, number 4, and so many other types of stimulations are there, but which uses only the acupuncture points. Please keep it in your mind. It is only the acupuncture points. What is moxa? Moxa is nothing but a leaf, some sort of a leaves, which you just make it something like a cigar and lit it and just keep near the acupuncture points so that this heat is going to create some sort of stimulation on the meridian. When the acupuncture points which are present on this meridian, particularly if they are excited, they have their own effects on the body. This is laser acupuncture. Here, what they do is application of non-invasive comfortable light beam. Non-invasive comfortable light beam. What is it? Laser. What is laser? Light amplification by stimulated emission of radiations. This is a very strong light which is stimulated by radiations. And when you just apply it on the strategic points instead of the needles, it is more comfortable and it gives rise to an active regeneration of the blood flow, that is chi force on the body. This is another method. This is also one type of laser acupuncture only. This is very easy to practice and non-invasive. The person will not feel any fear or pain of the needles. But in out of all these things, the best thing is really what I personally feel is it is needle acupuncture. How acupuncture works? We will see some of the things how it works. It strengthens the immune system, increases blood flow and antibody level, number 1. Number 2, it stimulates endorphins, natural painkillers, up to 10x stronger than morphine. It affects neurotransmitters, help body to cope up with stress, depression, mood, and some of the mood disorders especially. It affects circulations, restores health flow of blood circulation also. And on the other side, you can use this acupuncture for the following things: depression, anxiety, insomnia. Insomnia is nothing but lack of sleep, low back pain, high blood pressure, migraine, allergic conditions, indigestion, fertility support, menopausal issues, and much more things. You can use acupuncture for all these things. Now, one by one, we will just study how it works. Acupuncture promotes blood flow. This is significant because everything the body needs to heal is the blood. Blood contains oxygen, blood contains nutrients, and blood also contains immune substances. Blood contains hormones, blood contains analgesics. Analgesics means painkiller. Analgesia is pain. Analgesia is absence of pain. That's why the tablets or medicines one which we take are known as analgesics and anti-inflammatories also. This acupuncture has shown to increase blood flow and vasodilation in several regions of the body. Thereby, it helps to cure many diseases. Acupuncture stimulates the body built-in healing mechanisms. You can see in this diagram, very simple, there is capillary widening. What is capillary widening? A constricted capillary, when you stimulate with acupuncture, it creates a micro trauma. Trauma is nothing but an injury. It dilates the capillaries, to become big. So there is naturally increased blood flow. In addition to that, increased capillary permeability also helps to release of the fluid from the inflammatory areas. There is alteration in the white blood cells, and that alteration causes migration of white blood cells to the spot of the injury where they help to remove the debris. Debris means that is waste products of inflammatory reaction. And there is a systemic response, that is, for example, the toxins are released in inflammation that leads to fever and proliferation of white blood cells is another thing which also helps to cure this inflammation. And this inflammation curative action can be enhanced by acupuncture. Acupuncture benefits already have described. There is no need to this thing. It's only a diagrammatic representation. Acupuncture releases natural painkillers, reduces the pain. Here, the needle insertion on various acupuncture points, it sends a signal to the nervous system, to the brain, where there are certain things in the brain. Means mainly this, it sends information to the sensory system, sensory cortical areas, area number 3, 1, and 2 especially, and that releases certain chemical substances from raphe nucleus. If I just go on talking about all the complicated physiology, it may not be interesting to you. Anyway, I want to cut short those things. And these chemicals are endorphins, encephalins, and norepinephrine, and all these things are released, which are 100 to 200 times more potent than the morphine, which is morphine. This morphine is a known analgesics. If anybody is suffering from any type of pain for that matter, pain from the cancer, excruciating pain because after the operation, we are going to inject the morphine. So this acupuncture naturally releases all these substances. That is the character of this acupuncture treatment in relieving the pain. Acupuncture activates endogenous analgesic system. I told you how it works. This is the cortical areas. This is the sensory areas, perception area. And then when it perceives the pain sensation, it releases the neuromodulators. What I have already told you, like endorphins, encephalins, etc., analgesics, that is transmitted to the spinal cord where there are receptors. What is a receptor? A receptor is nothing but a biological transducer, one which can convert any type of energy into electrical signals. Otherwise, we call action potentials. These action potentials, what we call, they are the universal language of the nervous system. It is the universal language of the nervous system. So thereby, these action potentials are generated here and they are modulated because of these neurotransmitters. They block it and the pain is decreased. One interesting fact I want to tell you regarding this matter. In a war, a soldier is fighting. He will get injured, but he will never feel the pain till the war is over. It's mainly because of his excitement, anxiety, and other things, where this endogenous analgesic system also works. Similarly, this happens in the case of an accident. When anybody meets with an accident, in the initial stages, he will not feel any pain at all. But after some time, he will get excruciating pain. Excruciating pain means intolerable pain. Then it is mainly because of this endogenous analgesic system. Acupuncture relaxes shortened muscles. There are so many conditions like fibromyalgia and so many other diseases where the muscles go into spastic conditions, continuous contractility. So by releasing some of the neurotransmitters, this acupuncture releases these shortened muscles and it helps for a normal functioning of the muscle also. Feeling stressed? Acupuncture reduces stress. This, how it happens? There are two things. One is parasympathetic and sympathetic. Sympathetic always activity is always excitatory. It comes into action when there is a situation called fight, flight, or fright. Three things. Here only two things are here. One more thing is fright. Fight, you will fight against. You will fight or you will run away. Or you are afraid you will just sit in a place. All these things are the characters of the sympathetic activity. Whereas the parasympathetic nervous system is mainly for rest and digest. It is calm and it is a connected system. And mainly our things, our acupuncture, it works on this parasympathetic nervous system. How it works, I will explain in the next slide by releasing a substance called oxytocin. See this diagram. You can see here there is an anterior pituitary and there is a posterior pituitary gland. Anterior pituitary releases so many stimulating hormones: thyroid stimulating, adrenocorticotropic hormone, luteinizing hormone, follicle stimulating hormone, growth hormone, prolactin. These things are not important for our present discussion. But for the posterior pituitary, it releases two things. One is oxytocin and another is vasopressin. What are the functions of this oxytocin? Oxytocin, it helps to alleviate it works as an anxiolytic agent and it elevates your mood. It's a mood elevator, that is emotional, function of this oxytocin release from the posterior pituitary gland. And similarly, yoga also, please keep it in your mind. Again, I want to tell you, yoga also releases this oxytocin from the posterior pituitary so that our moods are kept at positive levels. And second important thing is social behaviors, maternal behavior. What is maternal behavior? Whether it is a cat, dog, human being, or even a lion, it the mother always starts liking children. And that is what is called maternal behavior. And this is also mediated by our oxytocin. And in addition to that, pair bonding. You know what is a pair bonding? I need not tell nowadays. And this is also main function, one of the functions, not main function, it is one of the functions of our oxytocin. And sexual behavior is also related to our oxytocin release. And cognitive functions. What is cognitive functions? Cognitive function is nothing but calculating the things or to analyze the complicated things. Number one, that is what is called the cognitive functions, which are the functions of the anterior part of the cortical area, cortex. And in addition to that, it also influences the retention of memory and also olfactory uh, olfactory things are also important. Olfaction is one of the most important modality among all the things next to optic. Next to optic. In addition to that, it has got auto regulation and auto excitation during birth and suckling. Oxytocin is one of the drug which is given to promote the delivery. So acupuncture also during delivery, and it has got a lot of benefits by releasing the natural oxytocin from the body, thereby preventing the supply of external oxytocin is not required at all. So here, this is the neuroendocrine functions are there. That is anorexinogenic effect. What is anorexia? Anorexia is it is a psychological disorder. I can say people they don't want to eat. There are natural anorexia and there are induced anorexia. In the induced anorexia, people they don't want to eat because they want to stay very slim, look very attractive. One complication of this anorexia is bulimia. They eat up to the brim of the throat, then they go to the toilet, vomit all the things. This is again a psychological disorder. By using this acupuncture, we can cure these diseases. And it has got lot of effects on this stress response. That is the acupuncture. What conditions may benefit from acupuncture? Already I have told you. Gastritis, irritable bowel syndrome, hepatitis on digestive side, and emotional side, anxiety, depression, insomnia, nervousness, and neurosis. Thank you very much. Again, I want to tell you that in our university, we are also doing a lot of research regarding this acupuncture. And if anybody interested, please, you are welcome to visit our university. And again, I would like to request you if you have got any questions, you can answer. Closer. How was the lecture?
No question.
Huh? No questions, sir.